Why do many patients ignore early warning signs?
People don't take these mouth ulcers very seriously.
Are young non-smokers also getting head and neck cancer today?
Yes, that happens because of a virus called human papilloma virus.
Why are head and neck cancer cases rising in India?
In rural areas, it is mostly because of chewable form of tobacco, and in urban areas, if you see, it is mostly because of smoking.
What is the one symptom people should never ignore?
I would say any ulcer in the mouth that is not resolving.
Head and neck cancers are often overlooked because their early symptoms can seem very common. And to discuss this, we have with us Dr. Supreeth, Medical Oncologist at Sri Shankara Cancer Hospital and Research Center. Welcome, doctor. It's
Hello.
noticed that head and neck cancers are one of the most common kind of cancers occurring in the male population today in India. So what are your thoughts on it?
So, as we all know, tobacco consumption is one of the most important social habits that we face in our country, especially among men, but in some parts of our country among women also. So, tobacco consumption is the commonest reason for head and neck cancers, and the most disturbing aspect of head and neck cancers is the way it affects the patient's overall appearance, which is cosmesis, and also how it affects the patient's day-to-day functioning. You have to eat through your mouth, you have to swallow the food, you have to breathe. The ability to perform all these day-to-day routine activities which are most essential for somebody's survival get hampered because of head and neck cancers. And that is why I see this as one of the most important menaces which is inflicted upon by the man upon himself to be addressed with utmost priority.
So what do you think are the early signs or symptoms you can notice when you...
So it depends on the area. See, head and neck cancer is a broad term. There are various subsides to the head and neck cancer. It starts with something called nasopharynx, which is there at the junction between your nasal cavity and your brain. So that is where the nasopharynx is situated, and a cancer that arises there is called nasopharyngeal cancers. Then you have something called sinonasal cancers, which happen in the paranasal sinuses. So especially the areas in the cheek bone, these are usually air-filled cavities. So within those cavities, cancers can arise. Then you have nasal cavity, which is your channels in the nose, and then you have oral cavity. So your oral cavity again is a very broad area where you can have cancer happening right from the lip, which is the most anterior part or the most front part of your mouth. And then you have the jaws, which is called alveolus in medical terms.
Okay.
Then you have tongue. Then you have buccal mucosa, which is the inner lining of the cheek. So this is the cheek externally, and its internal counterpart is called mucosa, buccal mucosa, which is the commonest area of oral cancer in India because of our habit of tobacco chewing, especially the gutka, which is placed between the jaw and the cheek, which results in this particular type of cancer. Then you have floor of mouth, which is beneath the tongue, then the tongue itself. Then you have base of tongue, which is the posterior portion of the tongue, which will be like a vertical wall. And then you have the pharynx. So your mouth essentially opens into something called pharynx.
Okay.
Upper one is nasopharynx, then you have oropharynx, then you have laryngopharynx. So the oropharyngeal area is one of the commonest areas for cancers among the head and neck cancers. Then you have larynx, which is the voice box. Then within the larynx, there are again 2-3 subtypes: above the larynx, below the larynx, etc. And then the posterior, the uppermost part of the esophagus. So you essentially your pharynx opens into esophagus. Esophagus is what we in popular terms call, or in lay terms call, food pipe. So the uppermost part of it is called the cricoid. So post-cricoid is one of the commonest areas for cancer. So these are the areas where your cancer can affect an individual depending on their tobacco consuming habits. For example, as I said earlier, somebody with a gutka chewing habit, the commonest site will be the buccal mucosa or the alveolus, the jaw or the inner lining of the cheek. Somebody who smokes, will mostly develop tongue cancer or a oropharyngeal cancer or a laryngeal cancer. So depending on the type of tobacco or somebody who sniffs, there are sniffing varieties of tobaccos as well, and somebody who sniffs, they are most likely to develop nasal cavity or paranasal sinus related cancers. So this is how the based on the area of involvement, the type of symptom differs.
Understood. Why are head and neck cancer cases rising in India?
Because as I said, in rural areas, it is mostly because of chewable form of tobacco, and in urban areas, if you see, it is mostly because of smoking.
Okay. Can a small mouth ulcer be an early sign of cancer?
No, not every mouth ulcer should put you under stress about having a cancer, because there are a lot of non-cancerous causes for mouth ulcers. For example, there is something called aphthous ulcer, which is or stress ulcer. So this happens randomly, or in certain individuals it happens because of consumption of certain varieties of food. Then you have
heat also.
That is what people explain it as in popular terms, but aphthous ulcers as such do not have precise cause, but one of the one of the well described causes is something called Crohn's disease, which basically affects the entire gastrointestinal tract. It can also affect likewise the oral cavity also, and that can manifest in the form of aphthous ulcers, but that is little rare. But otherwise aphthous ulcers happen randomly, they do not have any. Some individuals are prone to have these aphthous ulcers through their lifetime. They keep developing it, and it keeps resolving on its own without doing anything. And certain types of vitamin deficiencies can lead to mouth ulcers or the ulcers at the angle of the lips. So that is called angular cheilitis. So these are some of the common ulcers that, and also ulcers can happen because of sharp tooth, which can keep pricking a particular area, but by the way, that can also be a predisposing factor for developing or converting into cancer. So somebody with sharp tooth which is impinging onto the tongue repeatedly or onto the buccal mucosa, it is something that needs to be addressed as early as possible before it leads to cancer.
So it so happens that when you're brushing, accidentally, I think when your brush touches the membrane or the layer, we can develop an ulcer. So is that also concerning?
No, not at all. But any repeated trauma, even sharp tooth as a matter of fact, is basically the tooth is not causing the cancer. It is repeated irritation to that particular area happening over a period of many years, which is gradually converting into cancer.
Are young non-smokers also getting head and neck cancer today?
Yes, that happens because of a virus called human papilloma virus, which is the commonest cause of non-tobacco related cause for oropharyngeal cancer. And yes, many young individuals are developing HPV related oropharyngeal cancer.
Why do many patients ignore early warning signs?
As we discussed earlier, people don't take these mouth ulcers very seriously. They think that they resolve on their own. And a lot of times these patients will just have vague symptoms like loosening of tooth. Loosening of tooth is one of the commonest symptoms with which a patient with the jaw cancer presents to us with. So they just ignore it, thinking that it's just because of age that the
tooth might have gotten loose.
So that happens, and only after it reaches a certain point where the patient's pain is intolerable or multiple teeth are falling off, that is when patients present to a dentist commonly.
Got it. Is HPV also linked to certain head and neck cancers?
Yes, as we discussed, oropharyngeal cancer is one of the classical sites for HPV related cancers, but there are other cancers. Even cancer can happen anywhere in the oral cavity, the base of tongue. All these areas can have cancer because of HPV. Even nasopharyngeal cancer rarely can be caused by HPV.
Externally, if you were to notice any signs, what would it be? Maybe on the face?
Again, depending on the area of involvement. If it is a buccal mucosal cancer, patients will develop cheek swelling. So cheek gradually starts swelling. And if it is a lip cancer, patient will be able to see ulcer over the inner lining of the lip or at the angle. And if it is a tongue ulcer, obviously when you are brushing, you will be seeing, or there will be pain. In some advanced stages, there will be bleeding from that ulcer. So the ulcer would have gotten so bad that it starts bleeding. There will be foul smell from the mouth. So these are some of the common symptoms and signs by which you can identify head
So
and
neck,
neck cancers.
if you were to mention about
So
some
neck
external
is commonly, it
signs.
is called head and neck because in the neck area you have lymph nodes.
Okay.
So anywhere in the body you have lymph nodes, and these lymph nodes basically do the job of a traffic junction.
Okay.
So they collect all the bad blood and deliver them towards the heart for purification. So in this process, since they are collecting all the bad blood, they are also prone to collect these cancerous cells more. So any cancerous involvement in any of these areas would first spread, if they have to spread, to the lymph nodes.
Okay.
Either depending on the side. For example, right side of your tongue is involved, so it can go to the right side of the neck. Likewise, right side of the buccal mucosa, if it is involved, it goes to the right side of the neck. Since it involves these lymph nodes in the neck as well, they are called head and neck cancers.
What is the one symptom people should never ignore?
I would say any ulcer in the mouth that is not resolving.
Okay.
For a few months or weeks, you can say.
Weeks, huh?
Any ulcer in your mouth that is not resolving beyond 1 month is something that has to be taken seriously and should be evaluated.
Okay.
And obviously any swelling which is growing constantly in your neck area.
Okay.
Because your neck area can also harbor certain other types of cancers like lymphomas, which have no connection to the head and neck cancers. They are a separate entity. They are a type of blood cancer, but still they can present as neck swellings.
As you said, it's a junction, so we need to
Correct.
make sure that everything around it is. Can immunotherapy improve survival in advanced head and neck cancer?
Yes. It has shown in multiple studies that immunotherapy, either as standalone agent or when used in combination with chemotherapy, has given survival benefits. There are certain set of patients where when they become chemo resistant, you have given treatment for the patient to cure.
Okay.
And the patient is coming back with a recurrence within maybe 3 months or 6 months time. Now this patient is essentially considered as patient with chemo resistant or chemo refractory disease.
Okay.
So in those patients as well, immunotherapy among some of those patients has yielded very long term and sustained responses.
Okay.
And these patients went on to survive for longer periods of time.
Okay.
That doesn't go on to say that every patient who receives immunotherapy will survive forever, but definitely immunotherapy has changed the way head and neck cancers were managed as compared to what it was 10 years ago.
Would eyes also come under this domain, sir?
No.
Okay.
Eyes do not come. Eyes belong to a separate entity.
Okay.
There we see different types of cancers called retinoblastoma and etc. But they are mostly seen in pediatric population.
Okay. Any final message to our viewers?
If there is one final message that I can say is if anybody is consuming tobacco in any form, be it smoking form or be it in a chewable or in a sniffing form, it has to be stopped because it is the reason for all evils. It can cause cancer from head to toe anywhere in the body. So that is something that needs to be addressed by yourselves. You need self-help for that. Obviously, if you are in need, you can always seek help from some professional as well for smoking cessation.
Thank you so much, sir. It was a very informative session. And to all of you watching, stay aware and keep your lungs healthy and safe.